Welcome to the workshop, You Are What You Eat, How Food Choices Affect Recovery. My name is Michaela O'Brien, and I will be your moderator for this workshop. It's my pleasure to introduce today's speaker, Ms. Stephanie Wiese. Ms. Wiese is a registered dietitian and certified nutrition support clinician at the Colorado Blood Cancer Institute in Denver, Colorado. She supervises a team of dietitians in the inpatient and outpatient setting. She oversees the care of hematology, oncology, stem cell transplant, critical care, and steroid-induced diabetic patients. Please join me today in welcoming Stephanie Wiese.
Thank you, Michaela, and thank you everybody for your time and for being here today. I'm really excited to talk about all this exciting information about nutrition and the importance of it when we're talking about going through treatment, transplant, and recovery. So let's just jump right in. Here are a few of our objectives that we're going to cover today. I am not going to go into a lot of detail with the side effect management, but we're going to talk about nutritional needs of stem cell transplant patients and CAR T-cell recipients in the short and long term. We're going to talk through how to manage eating difficulties due to chemotherapy, radiation, GVHD, and other medications. We are going to talk about how food choices impact organ function and help prevent complications after a stem cell transplant or CAR T. Also, you'll notice in my slide deck, we use HCT for hematopoietic stem cell transplant, and we use that kind of interchangeably with bone marrow transplant, stem cell transplant. So you'll hear me kind of use all of those terms, and they're all meaning the same thing. We'll talk through some common myths associated with nutrition and cancer, which is one of my passions, and I love working with patients when they have questions or they've heard something or they've seen something, and they have questions for me regarding that. And then the role of prebiotics and probiotics in nutrition, which is also super interesting. So the first thing I wanted to talk about is the importance of nutrition post-transplant. So we're wanting to really recover. I mean, there's a lot of organs, there's a lot of cells, there's a lot of parts of your body that are going to need recovery, and they're going to need a lot of nutrition to do that. So when we think about nutrition, I always like to break it down into macronutrients and micronutrients. So protein, carbohydrates, and fats are going to be our macronutrients, and so they're really, really important for post-transplant recovery, but also they're important before, during, and after transplant. Protein is necessary for tissue formation, cell repair, which is huge. When you think about what chemotherapy and what some of these therapies do, they're damaging all of a person's cells, the cancer cells and their healthy cells. And so protein is super important for that cell repair because we're really wanting to bolster and repair those healthy cells. And then hormone and enzyme production, and then building strong muscles and a healthy immune system. Those are the other two really, really important details to remember when we're emphasizing the importance of protein intake. Want to keep you strong, want to get your immune system back healthy, and want to repair those damaged cells. And then carbohydrates are really important for just a steady source of energy, and they help provide structural components for the formation of cells. So again, when we're talking about anything to do with cell repair, and when we think about what treatment does, we're going to want to focus on those, on these three macronutrients. And then fat will provide stored energy for our bodies. It functions as a structural component for our cells. It helps signal and support proper cellular communication. And then it provides insulation to our vital organs and helps us maintain body temperature. So the micronutrients I mean, there's subgroups to all of these, but really we're wanting to look at vitamins, minerals, and water. And so those are kind of the micronutrients that we focus on. And vitamins and minerals really are important. They're involved in a lot of metabolic processes, so they help us use the energy and nutrients we get from the macronutrients, as well as really help our body and our organs create a state of homeostasis. So vitamins and minerals are very, very important, very, very important part of our diet. And then water, of course, it helps transport things in our bodies. It helps remove waste products. So staying hydrated is also really, really, really critical, again, before, during, and after treatment, transplant, CAR T-cell therapy. So now we will move on to talk about kind of short-term and long-term nutritional needs of both stem cell transplant patients and CAR T transplant patients or CAR T-cell therapy patients. So in the short term, and these are just short-term goals and things that I talk about with the patients that I get to work with. So short term, we're wanting to make sure that we're meeting calorie and protein needs. So calorie and protein needs are much higher during treatment and transplant. We call this being in a hypermetabolic state, meaning internally your body is in a state of stress, whether it's dealing with an acute illness, a disease state, and then the treatment that we're giving you. Your body is inflamed and trying to initiate lots of functions and lots of repair that requires extra nutrition. These energy needs can be higher for up to 90 days after transplant, usually longer for allogeneic transplant patients. It can be a little bit longer than that, but typically we do see the higher energy needs for a little bit longer. So short-term nutrition goals. So this is what I say for like 1 to 2 months after transplant, and I kind of preface, when I'm working with patients that, there's nutrition before transplant or treatment, during, and then after, and they do all look a little bit different. So I always want to be very clear that some of the things that we recommend during treatment or during transplant, and then, quickly right after them post-transplant, are a little bit different than what we would recommend long-term or what we would recommend before. So these are short-term nutrition goals for 1 to 3 months after transplant or treatment. So small, frequent meals to meet calorie and protein goals. Typically, when you've been through treatment or transplant, your GI tract is inflamed. It's not working at its full capacity. And so eating or consuming large volumes of food and large meals usually is not realistic. And so breaking those down into small, frequent meals, eating every 2 or 3 hours to meet your protein goals. The other thing that this does is it maintains gut integrity. So if someone goes days and days and days without anything in their gut, in their stomach, their gut can start to atrophy, and it can create all kinds of complications, and we don't want that to happen. So we want to maintain that gut integrity and gut function by having it do its job, which is digesting and absorbing food. We want to maintain lean body mass, and so we want to participate in physical activity daily. And the other piece of that, maintaining that muscle mass, is going to be meeting estimated calorie and protein goals. So the estimated calorie and protein needs during a transplant, and these are a little tricky because they are in kilograms of body weight instead of pounds. And so that conversion, in case anybody wants it, is you would take your weight in pounds and divide that by 2.2, and then that would be your kilograms of body weight. And so your estimated calorie needs during transplant, during treatment, are typically 25 to 30 calories per kilogram of body weight. Now, there is some nuances. I mean, if somebody's morbidly obese, we have to use an adjusted weight, which is a totally different calculation, but these are pretty standard. And then they would be increased from there to 30 to 35 calories per kilogram of body weight if a person is malnourished. So if somebody comes in and is very, in a deficit, malnourished, has some cachexia going on, then we're going to want to bump up and increase the amount of calories that they're needing. And then typically it's 1.3 to 2 grams of protein, again, per kilogram of body weight. So to do those calculations, you would just take your weight in kilograms and multiply it by 1.3 to 2, and that would give you a range of protein goals. And then we're also going to want to manage GI side effects with medications and then food choices when able. And we'll talk a little bit more about that in some other slides, but making sure we're taking the medications that help with nausea or diarrhea, and then also making sure we know, okay, if I'm having any of those GI symptoms and side effects, what are some food choices that I can make that will kind of help with those? And then, so short-term nutritional needs of CAR-T recipients, a little bit different. That treatment does look a little bit different than a stem cell transplant. So the most common side effects of CAR-T cell therapy that can impact nutrition are cytokine release syndrome, so CRS, neurotoxicity, and usually those side effects resolve within the first 30 days, but that's usually, but not always. And the release of those pro-inflammatory cytokines are known to reduce appetite, increase the body's demand for nutrition, and accelerate catabolism. So what we mean by accelerate catabolism is this type of therapy is going to accelerate the rate at which the body breaks down muscle, typically muscle. Sometimes it'll break down fat, but protein is in our muscle, and that's kind of the preferred fuel if we're not eating and drinking enough. But it accelerates that rate that your body is breaking down muscle. So some of the short-term goals we work with our CAR-T patients on is, again, the small frequent meals, and then making sure, since we know that neurotoxicity and confusion and CRS is the most common side effect, we're going to make sure mentation is appropriate and our patients are swallowing safely. So we don't want any aspiration, we don't want choking, we don't want any of those risks at play. We want to maintain lean body mass. So again, consuming adequate calories and protein. Estimated needs are about the same, and then continue physical activity to preserve lean body mass. So the patients that I get to work with before, after, and during treatment, I'm always saying, the two things that you really can control and add the most value to your treatment is eating and moving, because those are the two things that have the most impact, besides the overall treatment, that you can control. Those are the couple of things that are really important. So long-term nutrition goals, these are super important. So now we've kind of moved on from that acute phase. So this is like 3+ months out of your treatment transplant. The long-term nutrition goals we want to focus on are maintaining a healthy body weight. I'll kind of go into this a little bit more when I'm talking through some of the myths, but maintaining a healthy body weight is important. Participating in physical activity for at least 30 minutes per day. Household chores count, vacuuming, laundry, dishes, all of those things count. Walking, biking, resistance training, those are all going to be really important for maintaining that muscle mass, maintaining that strength, which is just very, very important. Limiting alcohol consumption, avoiding sugary sweetened beverages, and limit consumption of salt preserved or highly processed foods. So these are all recommendations that prevent cancer and prevent reoccurrence. I'll run through some more of them. So we want to aim to meet nutritional needs through diet alone. So what that means is I'm not relying on a bunch of different supplements to meet my nutritional needs. We can use them to supplement if we're lacking, but really eating a variety of fruits and vegetables, which is 2 to 3 servings of fruit and 3 to 5 servings of vegetables per day, that's really key. So most patients I work with And interestingly, I mean, I'm a dietitian, so I get lots of nutrition questions from friends, family, coworkers, and the things that I say, that there's three things that I really think are the key to just an overall good nutrition status, and it is meeting your daily recommendations of fruits and vegetables, meeting your daily protein needs, and moving your body. So if there's three things you take away, those ones are very important. And the reason that eating the fruits and vegetables are so important, I could do a whole talk on phytonutrients alone because they're so important and they're so interesting. But phytonutrients are just beneficial chemical compounds that are found in fruits and veggies. So think about antioxidants, flavonoids. I mean, there's hundreds of these chemical compounds that are so beneficial to so many different parts of our bodies. So try to eat and cook with a wide variety of vegetables. When they say eat the rainbow and try new recipes and try new ingredients, that is super important. The fiber in fruits and vegetables, also super important long term. Meet your protein goals with lean meat, poultry, fish, beans, legumes, tofu, tempeh, and then limit consumption of red meat and avoid processed meat. So red meat 1 to 2 times a week, that's what we consider limiting it. And then avoiding processed meat. Again, if you're having it once a week or something like that, it's not going to have the same impact as if you're relying on that as your sole source of protein. So I'm going to run through some of these GI side effects. I'm not going to spend a ton of time on each one of those because I want to get to some information about GVHD and the nutrition and cancer myths. So mostly every patient that I've worked with has some type of gastro-GI problem. Cancer treatment, chemotherapy, radiation, some of the medications, they cause inflammation and damage to the GI tract. Some of the most common ones that I hear about and work with patients on are poor appetite or feeling full early. We call it early satiety. Some of the interventions or recommendations, eat by the clock, kind of like I was talking about earlier, making sure you're setting, either the timer on your phone or a loved one's reminding you to eat. Because loss of appetite is one of the biggest reasons that patients will lose weight and lose muscle mass and functionality, is just their appetite is gone. Drinking high calorie, high protein fluids like protein supplements or smoothies. Smoothies are also a great way to pack in your servings of fruits and vegetables. I mean, in some servings you can get, or in some smoothies you can get 3 or 4 servings of fruits and vegetables. And if you add in like spinach or kale, you're getting one of your vegetables too. So I always like to, and there's just so many recipes out there. We have a lot of different ones that we like, but if you, look anywhere on the internet, there's a ton of smoothie recipes. Adding some protein in there is great too. So maximize intake when you're the most hungry. Eat in pleasant surroundings, avoiding stress and conflicts. This is a really, really important one, and I feel like this one is underutilized just because it's not talked about a lot. But making sure when you're getting ready to eat, okay, are you in an environment that is peaceful to you? And how are you feeling when you're eating? Maybe change up the setting, maybe put on some music, or, what smell is happening, and just paying attention to all of your senses to really set you up for success if you're struggling eating. A lot of times changing the environment. Eating outside if you can, eating in another part of the house. Just kind of switching things up can be really beneficial if that's a struggle. Getting treatment for contributing conditions like constipation or depression, and then looking at medications that can decrease or depress appetite, and then possibly talk to your doctor or healthcare provider about using an appetite stimulant. Those can have great benefits. Sometimes they don't work, but sometimes they do. So want to make sure everybody has all the tools and resources to try. So nutrition interventions for taste and smell changes. Again, not going to run through all of these, but there's lots of different ways to add or take out if you're having an off taste. Usually trying sweeter foods are usually the thing that tastes the best. If it's a loss of taste, marinating meats, using stronger, heavily spiced food is really beneficial. And typically, if it's a metallic taste, using plastic utensils instead of metallic or metal silverware helps. And then the other thing that I always like to talk through is, when we're having taste changes, some of it can be due to dry mouth. And so we want to really assess that and address that if dry mouth and oral hygiene is causing that. Chewing on sugar-free gum, sucking on lemon drops, mints throughout the day, ginger candies can be helpful too. Again, that's all going to help with dry mouth and creating that saliva. Avoiding strong smells, avoiding cooking areas if you're dealing with any nausea, choosing cold or room temperature foods so they don't have a strong smell. And then trying a zinc supplement is also, it can be beneficial if you have a true zinc deficiency, and that can happen if you have prolonged poor nutrition intake. Sometimes a zinc supplement will help your taste return. If it's not, though, if the taste changes and alterations are caused by the treatment, the zinc supplement is not going to help those. So we just kind of talked about dry mouth, but this is a very, very common side effect of most treatments. So eating foods with sauces or moist, gravies, dips, or dip dry foods in liquid, alternate bites of foods and sips at meals. Again, sucking on hard candies. Frozen grapes are also really good for dry mouth. They can really help your mouth produce some saliva. And then thinning oral secretions with carbonated beverages. This can be really helpful when you have thick oral secretions or secretions in your esophagus that water just won't cut through. Carbonated beverages can help with that, or papaya nectar. And then using biotin or lubricity as artificial saliva. We've heard a lot of really good feedback about lubricity for dry mouth. It's newer on the market, but I think it's really promising. Nutrition interventions for mouth sores and mucositis. So soft foods, easy to swallow, avoid dry, chewy, or crunchy foods. Obviously, that is going to be painful. Again, dunk or soak foods in liquid to make them softer. Avoid acidic and citrus flavored foods and juices. Those can be really painful. Utilize bicarb mouthwash. That can really be even preventative from developing those sores. And then using and utilizing lidocaine or dexamethasone swish and spit for oral pain relief. For nausea, vomiting, reflux, and burping, making sure you have the proper antiemetics, so Zofran, Kytril, Compazine, Ativan, whatever works for you, and making sure you're taking them on time. I usually tell the patients that I get to work with, timing them 30 to 45 minutes before meals, just making sure you're almost like pre-medding your meals to keep on top of those things. Smaller, more frequent meals are going to be helpful. Avoiding high fat or greasy foods. I will get into this a little bit more when we're talking about GVHD, but high fat foods and high fiber foods are just harder for our bellies to digest. So long term, we don't want to avoid fat and fiber, but when our GI tract is inflamed or in distress and not feeling good and not working properly, we want to limit those foods that are harder for it to digest and increase the foods that are just easy for it to digest and absorb. Avoid medications on an empty stomach. This is a big one. Unless required, I do know there are some medications that do need to be taken on an empty stomach. Try ginger-containing foods, ginger candies, ginger chews, ginger teas. Those are a natural antiemetic. And then acupuncture bracelets, massage, distraction techniques. I have patients try any and all of these because everybody's body is a little bit different to what will give them relief. Nutrition interventions for diarrhea. This is a very common one too, and it's a bit tricky because we can't so much manage your GI side effects and diarrhea that are being caused by chemotherapy. We can't manage those with food because they're not being caused directly by the food. It's not the same as like, an intolerance or an allergy where you just cut that food out and kind of go on. It's we're just trying to manage the side effects. So I always like to discuss food history and symptom history with the patients I get to work with. Try to correlate. Okay, are you having bouts of diarrhea after every meal, after a certain meal? What's in that meal? Is it after a certain medication? Is it a certain time of day? I mean, we really want to try to pinpoint because it helps when we're trying to manage some of these side effects. And then again, trying low fat, low fiber, low lactose diet. Again, dairy and lactose aren't inherently disruptive or bad, but they can be harder to digest for our stomachs, all of these foods. So we just want to limit those foods. Avoiding gas-producing foods or caffeine. You can consider bulking agents or soluble fiber foods. I find bananas or banana flakes, rice, stuff like that can really help bulk the stools. Avoiding sorbitol or other sugar alcohol containing products that can actually cause osmotic diarrhea. So we definitely don't want that. Drink plenty of fluids and consider electrolytes or multivitamin. We just don't want you to get dehydrated. So now I want to just talk through how we approach graft-versus-host disease or GVHD from a nutrition perspective, because it is really complicated and it can be really scary, dangerous, all of those things. And it is a very common complication of allogeneic stem cell transplants. And so it's a complication of the donor cells attacking the host organs, and in this case, the GI tract. And so the symptoms can be mild, moderate, or severe, including nausea, vomiting, diarrhea, blood in the stool, abdominal cramping, poor appetite, and severe weight loss. And so we're managing and making recommendations pending all of these GI side effects. And typically our recommendations are based on the grade of GVHD and what is being impacted and symptoms and symptoms that are being reported. So standard GVHD treatment always involves high-dose corticosteroids or steroids, prednisone, solumedrol, dexamethasone, all of those. And then there's a lot of other really new exciting drugs out there to treat GVHD. I'm not going to go into those. I'm not a pharmacist, so I'm just going to speak to the nutrition piece of it, but just know that as providers, as clinicians, we're working closely with providers, the physicians, the pharmacists, because we know all of this impacts the care of our patients. So diet modifications, like I said, vary depending on severity of symptoms, but really we want to avoid high-fat foods. We just know those are harder to digest. Avoiding high-fiber foods or limiting those, avoiding acidic foods, caffeine, and dairy. Those are all foods that are harder to digest or can cause a little bit of irritation to our GI tract. So what we're wanting to do with this is focus on easy to digest carbohydrates and lean protein. So I kind of run through some of those on the right-hand side. So fruit without the skin. So bananas, applesauce, canned pears, peaches, even smoothies with, berries and things like that are really can be appropriate and easy to digest. White rice, white bread, pasta, low fiber cereal, potatoes, sweet potatoes. Again, those are all just really easy, mostly simple carbohydrates that our bodies and our bellies can just digest easily. And then lean protein, eggs, egg whites, chicken, turkey, tofu, fish, usually white fish, tilapia, cod, or flounder. They're all a little bit lower in fat, just a little bit easier to digest. So calorie and protein needs with patients dealing with GVHD are higher than even during treatment. Again, your body is going through a lot. So they typically need 30 to 40 calories per kilogram of body weight, and then 1.5 to 2 grams of protein per kilogram of body weight. And then in cases of malnutrition or severe complications, even more protein than that. So same calories, but 1.8 to 2.5 grams of protein. So you can see when we're trying to combat and heal a gut impacted or damaged by GVHD, your protein needs are a lot higher. So that kind of can show you just the importance of that during treatment, transplant, and dealing with any of the complications, just the absolute importance of protein when we're talking about recovery and repair. So like I said, the standard treatment is steroids for GVHD and muscle wasting. Muscle atrophy, myopathy is just a common and unfortunate side effect of using steroids. But the steroids are necessary because they do treat the symptoms of GVHD. So the muscle wasting it typically happens in the first, could be month or two after starting high dose steroids, and can cause weakness, atrophy, usually in the hands, legs, arms, and feet. And the prevention and treatment is really interesting because it's just kind of like the what I've been talking about for all the other recommendations of really meeting your calorie and protein needs, making sure you're getting enough calories and getting enough protein, not forgetting about vitamins and minerals and healthy fats, and then that physical activity and resistance training. That's the piece of this that I really want to drive home, because that can be super beneficial. And whether it's, getting a physical therapist on board to teach you some activities or teach you some resistance training exercises, is going to be super important. It's a super important piece of this puzzle. And then tapering steroids if able. Sometimes it's a very fast steroid taper. Sometimes it's, you're going to be on a certain dose of steroids for a prolonged amount of time. So the couple of things that you can do to help with that, help with preventing or slowing down the muscle wasting or atrophy, is just meeting calorie and protein goals and then moving. So I'm going to run through some of the most common cancer myths that I hear from my lovely patients that trust me with their questions that they see. I mean, we all see stuff online. We all read stuff, and I think it's wonderful that people are interested in their care and their health, and they're trying to figure out things online. And so with the good information can also be some confusing information. So I really like vetting some of these things out and getting these questions from my patients. So the most common one that I hear is sugar feeds cancer. Again, I could probably do a whole presentation about this, but I will say, and I look into this frequently and thoroughly, is a direct link between sugar intake and cancer has not been found. However, excess sugar intake can lead to obesity, and that chronic inflammation with obesity can and does increase your risk of cancer. So I shouldn't say can and does, it can increase your risk of certain types of cancer. So glucose or sugar feeds all of our cells, our healthy cells and our cancer cells. So if we just stop eating sugar, I've heard that, we'll starve the cancer. Cancer cells are so smart. They will find other metabolic pathways to leach energy and get that. They will find a way. So that unfortunately is not totally how it works. Now, I don't recommend eating a diet full of excess sugar, especially refined sugar. The recommendation is eating less than 25 grams of added sugar per day. And that's not a lot. So you can see, we're not saying there's a direct link, but we're also not promoting a diet full of processed sugar. So weight loss is desired during cancer treatment. I get this a lot. I've been trying to lose weight, now I finally am, and I'm gonna just go with it. And unfortunately, during times of treatment and during times of acute illness, especially when dealing with cancer, the weight loss that happens is primarily from your muscles. And that is the opposite of what we want. And so there's lots of studies that show a loss of as little as 6% of body weight can predict reductions in treatment response, survival, and quality of life. So 6% is not a ton, but as it goes up from there, we see quality of life, response to treatment, and outcomes decrease. And I always like to say weight loss can be done post-treatment in a very healthy way that preserves lean body mass and gets you moving, and makes sure you're nourishing your body. Typically during times of treatment, you're undernourishing your body, you're losing muscle mass, you're losing strength, and that's not what we want to do. So it can be done post-treatment. It's just we want to wait until things kind of settle down, you're not actively getting treatment anymore, your metabolism slows back down, all of those things before we start talking weight loss. Juice cleanses and detox are beneficial during cancer treatment. There are lots of different ways to add in vitamins and minerals. I don't recommend juicing or only juicing as a sole source nutrition, because you're missing out on fiber and protein and calories in those cases. There are superfoods that alone can fight cancer. So I love all of these foods in general, but there's not one of them that you're going to add to your diet to fight cancer or totally revamp your nutrition status. It's just the food industry. They're kind of tricky. They're kind of tricky with their marketing. High doses of vitamins and minerals can be beneficial during cancer treatment. We don't want to do mega doses of anything. It can interfere with medications. It can put extra strain on your liver and kidneys. So again, we want to get those through eating fruits and vegetables. Just want to run through probiotics and prebiotics. I know I'm getting a little short on time here, but probiotics and prebiotics, so good for your gut health. Usually want to get them in food form. There are some instances where a supplement is recommended, but we always have to remember that the supplement industry is unregulated. So we don't totally know what bacteria are in those, and we don't want to introduce live bacteria, especially to somebody who has a compromised immune system. But the probiotics or bacteria in foods, they are regulated by the FDA, and so there's a list of foods: fermented vegetables, fruits, yogurt. Yogurt's the kind of preferred. It's just easily accessible. Kefir, kombucha, miso, tempeh, those are all really good ones. And then prebiotics are going to be the fiber-rich foods which help, which feed your gut bacteria. So they feed those probiotics. And there's also a lot of protective properties that are produced as a byproduct when our gut bacteria eat prebiotics. It actually produces butyrate that can help heal and protect our digestive tract. So that is also an added benefit. And then I have some food sources here of prebiotics. I'll just quickly run through. You can see the CFUs, or the colony forming units, in probiotics versus foods. Kefir, yogurt, kimchi, all are going to have a lot more CFUs in them naturally. Supplements typically contain 1 to 10 billion per dose, and we don't know where those capsules are dropping them in the GI tract. There's a lot of kind of technicalities with the idea of probiotic supplements, but I will say they are more bioavailable, meaning your body will absorb and use them properly in food form rather than in supplement form. Yeah, I think that was my last slide, and I think I made it with only 1 minute to spare, so that was good.
Thank you, Ms. Wiese, for this excellent presentation. We will now begin the question and answer session. If you do have a question for Ms. Wiese, please use the chat box on the lower left side of the screen to type in your question. We will answer as many questions as possible. Okay, our first question is, I have developed multiple new autoimmune diseases since transplant. Are there any diet changes to reduce autoimmunity?
Oh, that's a really good question. So most autoimmune diets, I won't even call it a diet, but there's usually gluten sensitivity. And so minimizing or cutting out gluten would be my first place that I would start with that.
Great. What are some helpful resources for treating steroid-induced prediabetes? Any guidance in the number of carbs for meals?
Oh, that's a good one too. So yes, so for number of carbs per meal, we usually want to stick around 60 to 75 grams of carbs per meal. That's kind of what our body, metabolism, pancreas can handle. And so that's the goal of carbs per meal. And as far as resources, there's a lot of diabetic resources. The American Association for Diabetes is probably the most reputable one. And so that's the one that I would recommend. Let me just make sure I'm giving you the right association. Yeah, that's the one. It's diabetes.org. That's what I was just trying to look at the website for that.
Thank you. This patient has graft-versus-host disease and they're taking steroids and antibiotics. Is biotin safe to use if you have graft-versus-host disease?
So there's a few questions that I would ask. It wouldn't be a totally straight answer, but I would say, why are you wanting to use biotin? And I'm guessing maybe hair, nail, stuff like that, because we get that one a lot too. But that one can interact with immunosuppressants. So you might just want to, most of us dietitians or healthcare providers that work at cancer care clinics, we have access to, it's called a natural medicines database, and we can type in the supplement that you're interested in, and then we can compare it to interactions with a bunch of different medications just to make sure there's no severe interactions. So I would ask your provider if they can, if I had it in front of me, I would do it for you, but I don't. So I would ask them if they can compare those two, because it might be totally fine.
This is a question on protein as far as protein intake post-transplant. Any suggestions?
Yes. So like I said, if you are kind of looking for what your protein goals, that's where I would start. I always start with everybody is like, what is our goal protein? So, I mean, say you're 150 pounds and, that's 68 kilograms. So you would want to figure out, okay, well, how much protein am I aiming for, right? Probably right around 100 grams of protein. And how are you going to get that? Making a plan of like, okay, do I want to do, how many eggs for breakfast and how much protein is that? What am I going to do for lunch that's going to have protein? Am I going to do like a tuna fish sandwich? Am I going to do rotisserie chicken on my salad? How am I going to incorporate it in each meal? And thinking through lean protein options, and then getting it in with snacks can help too. High protein snacks are beneficial, and that can be anything from, an apple with peanut butter. Beef jerky can be high protein, even though it is processed. Protein supplements, string cheese has a little bit of protein, yogurt, cottage cheese. when you're talking about meeting a protein goal that's a little bit higher, you're wanting to just kind of plan out your day, but also know what your goal is.
Okay, here's another egg question. Would you recommend limiting eggs because of cholesterol if a patient is on a statin?
That is a great question, and I love this question so much because I get it all the time, even from doctors. So before I ever go after somebody's egg consumption, I would want to look at the rest of their diet and where they're getting cholesterol or saturated fat. If they're not getting it anywhere else and it's only the eggs that contain it, then yes, we could talk about doing egg whites. But if they're eating fried foods, if they're eating pastries, if they're eating a lot of other just high cholesterol containing foods, that's the stuff that I would want to cut down on rather than the eggs, because eggs contain so much good nutrition. And I know that's like just the thing that everybody thinks about when they're thinking about cholesterol, but that would be the last thing I would cut back on. But I would want to look at the whole, probably a couple days worth of like, what else are you eating?
Okay. This person is post BMT for 7 years and they have non-smelling gas every day. Does this mean anything? I rarely drink soda.
Interesting. That's a good question. I would also, and you'll see a pattern here because I have my patients do this all the time. I would keep a food diary, and then alongside the food diary, is there a time of day that it happens? Is there something that kind of triggers it, or at a certain point of the day? Is there certain foods? Because really, that's the only way to pinpoint it. It doesn't sound like cause for concern, especially if it's not causing you any, uncomfortable symptoms, and not any bloating or anything like that. But yeah, I would try to pinpoint what's causing it by way of food diary / kind of looking at when you're developing the gas during the day.
Okay, you mentioned honey as a prebiotic, but for this patient, honey was not allowed after transplant. How long before can it be consumed safely?
That's a good question. We get this one a lot too. So typically, that's a hard one because typically we're looking at kind of overall clinical picture and blood counts and all of that, but usually 3 to 6 months after transplant. Again, depending on lots of other factors, it is considered safe.
What resources would you suggest to make the best dietary decisions? Is there an app you could recommend or an internet site, reference materials?
That's a really good question too. So I really love, and it kind of depends on what your nutrition goals are, but there's so many great resources out there. So if you're wanting to diversify your diet, add in more fruits and veggies, and get some more recipes, a website that I absolutely love is called cookforyourlife.com, and it has so many recipes, so many it has a plethora of information, so I really like that one. And then if you are an app on your phone, if you're wanting to look at kind of total calorie intake or protein intake versus what your goals might be, there's a lot of those kinds of apps that I think are helpful, especially if you're first starting out to, okay, I want to make some diet changes, whether it's increase protein or eat within my calorie goals. And so sometimes you don't know how much you're eating, or if you're meeting those goals until you track it. And so some of those tracking apps could be as easy as, the one I think is the easiest to use is MyFitnessPal. And it has, all the different types of foods, all of their nutrition values, and it just kind of can give you a better idea of, okay, what am I doing in a day? Like, what does this look like? And where, areas for opportunities and improvement. So those are two resources that I like to point my patients to.
Hey, here's a question on soy and whey protein. Is soy or whey protein recommended? Does it contribute to inflammation?
That's a good question too. I get that one a lot. So I will say with any protein supplement, including soy, whey, protein, or pea protein, everybody has a different preference and a different tolerance. So some people don't really digest whey as well as like a soy-based protein. And so by that, I mean, when they eat it or drink it in a smoothie or supplement, they experience gas, bloating, maybe burping or heartburn. And so then I would say, okay, well, let's move on and try a different one, because for some reason your body or your GI tract is not digesting and absorbing that well. So neither of them is known to cause inflammation across the board. I will say everybody's belly, especially post-treatment or transplant, tolerates things a little bit differently. Some people tolerate whey really well, and they don't tolerate like a pea or like a vegan-based protein powder. So it kind of varies, and it's a preference thing too on taste and all of that. So hopefully that answered your question.
Okay. This male patient is 7 years post BMT. They're 43 years old. Their pre-weight before BMT was 182 pounds. Now they weigh 205. They've tried everything to regain the previous weight, including exercise, cutting out desserts, processed foods. I just can't get my weight down. Do you have any ideas or suggestions?
Oh, that's a good one. And I know it's interesting because during all of this, I think it doesn't get talked about enough that body composition changes because of treatment in a lot of cases. And so just be kind to yourself. Don't be overly frustrated, but also maybe looking at a couple of days of your intake and physical activity and saying, okay, well, maybe I'm not meeting my protein needs. So maybe with building a little bit more muscle and having a little bit more, like strength training kind of stuff, weightlifting, plus increasing my protein needs, I'll build a little bit more muscle, which automatically increases your metabolism. So looking at things more on what to add in instead of what to take out, because that can be super defeating. I think when you add things in and try them, if they don't work, you're like, oh, okay, well, maybe I'll add something else in. But if you are constantly restricting and it's not working, I think that can be so defeating and frustrating. So maybe try to add a couple things in.
Okay, this is a female patient who's 5 years post-transplant, and she's physically active. Initially, she had a hard time keeping on weight, but now her metabolism seems to have slowed down. And unless she watches what she eats, she's fearing that she's going to gain unwanted weight. Does your metabolism change long-term after transplant?
It can, yes. The simple answer is it absolutely can. And we see that happen. And like I said, some of the body composition and hormonal changes that happen. There's just a lot of things that are impacted by treatment and transplant. But again, I think if you're thinking about, okay, your goals are kind of maybe, it sounds like weight maintenance, or I would say even strength maintenance. And so how can you focus on, okay, my weight might fluctuate, and all of our weights will fluctuate in life, right? But how can I maintain the functionality of my body that I've worked so hard at having? How can I maintain that with things that I'm adding in and nourishing it with, whether that's, again, you're going to have your own set of protein or your own set of goals. But looking at that as, maintaining strength instead of fear of losing weight, just kind of tweaking some of those things can be really helpful, because that can also be defeating.
Okay, this person is dealing with ocular GVHD, specifically dry and burning eyes. Do you have any dietary or nutritional recommendations or possibly supplements for dealing with ocular GVHD?
I wish I did. I really wish I did. I do not. That is one that, man, I'm sorry that you're dealing with that. I don't have anything that I've seen on diet in connection with ocular GVHD. I'm sorry.
Okay. This person is a caregiver of a spouse who had a stem cell transplant 2 years ago. Is the DASH diet appropriate after a stem cell transplant?
Yes, I love the DASH diet. I love the Mediterranean diet even more, because it's adding in a bunch of healthy fats and healthy calories. But there's a combination of those two diets that is, I can't remember the name of it off the top of my head, but it kind of blends those two diets together. But yes, I do like the DASH diet, and I do like, I love the Mediterranean diet, and that one has been researched over and over and over, and just shows increasing, benefits in health over and over again.
Can you tell our audience what the DASH diet is?
Yeah, so it's typically low sodium, low processed foods. I forget what DASH stands for. Okay, dietary approaches to stop hypertension. So yeah, mostly just low sodium, low processed foods. It's kind of like the Mediterranean diet in that you're eating a lot of fresh fruits and vegetables. Like, that's the kind of the bulk of your diet. You're incorporating lean proteins, you're limiting foods high in saturated fat and processed meats, a lot, high salt processed foods, and then limiting sugar sweetened beverages. So in a lot of ways, it's kind of like the recommendations that I was talking about earlier. But yeah, that's used for a lot of like heart health, but it's definitely it's overall health that this will help you with.
Okay, this patient was told, they're post-transplant, but they were told not to eat lettuce, some vegetables, and fruits because of the bacteria, that you can't wash it off. Is a vinegar cold water wash appropriate, or should I just stay away from some of these fruits and vegetables?
That's another really, really good question. So we stopped having our patients follow the neutropenic diet, I want to say maybe 7 or 8 years ago, because there was a bunch of new research and literature published that it was almost causing more harm than it was preventing risk of infection. And so I absolutely say yes, the 1 part vinegar, 3 parts water, even warm tap water. But it is important to continue to eat fresh fruits and vegetables. The one thing I will say is, the prepackaged spinach, I would definitely wash that again. I would definitely make sure there's no, funky, slimy pieces of spinach on the bottom or anything like that. But we have not seen an increase in foodborne illness or bacterial infections from letting the patients we work with eat fresh fruits and vegetables. We really educate on hand hygiene and then washing those before they eat them.
Well, thank you. We are running out of time, and on behalf of BMT InfoNet and our partners, I want to thank Ms. Wiese for a very helpful presentation. And thank you, the audience, for your excellent questions. Please contact BMT InfoNet if we can help you in any way, and enjoy the rest of the symposium.